Ladies and gentlemen around the Delaware Valley, welcome to the Pain and Wellness Hour with Sonny Banks here on WWDB Talk 860. How are you, Sonny?
I'm doing good, Joe. We've got a great show today. We're changing things up a bit, having a doctor guest.
Yes, absolutely. And not only that, a doctor with a very interesting specialty.
Very interesting.
And so I'm ecstatic to bring into the program Dr. Mark Saracino. Doc, how are you?
Very well, thank you. Thank you for having me. It's my honor.
And it's great to have you back on the broadcast. If you would, tell her, first of all, you're a chiropractic neurologist, okay? Been doing the show 7 years. That specialty is very unique. If you would...
Let me add to that.
Please.
I've been practicing law for over 35 years, and I know one doctor of that specialty.
Right, exactly.
That's Dr. Saracino.
I was on my way up that path, but couldn't get past Biology 1, so it becomes a problem. But, Doc, if you would, tell our listeners a little bit about, what a chiropractic neurologist is and about your practice.
I've been in practice 40 years as of February 1st of last month. I was one of the first 5 board-certified chiropractic neurologists in Pennsylvania. It's a rare and exclusive subspecialization within chiropractic. I was fortunate that the first 3 classes were offered in Boston, Philadelphia, and Orlando. Now they're offered all over the world, and that's much more popular. Now there are about 17 board-certified chiropractic neurologists in Pennsylvania. We have nothing to do with medicine in any way with chiropractic, other than the fact that our national board examinations are similar. Okay. Part 1, Part 2, Part 3. The third part, or the fourth part of the National Board of Examiners tests for medical doctors, osteopaths, and chiropractors, because you have to start out as a doctor of chiropractic before you can become a board-certified chiropractic neurologist, starts to divert into the nutrition and the biomechanics and the manipulative sciences, whereby medicine gets more into the surgical and medicinal uses for
Sure.
What it does. It's a 3-year postdoctoral degree, and it requires board certification by the American Chiropractic Neurology Board, which is under the guise of the Federal Department of Education through the Council on Chiropractic Education. So you have these specialized boards that have to adhere to the standards set by the profession that are overseen by the federal government Department of Education. And it's true. There are osteopaths who are neurologists. Mm-hmm. We sometimes just call them neurologists, but they're osteopathic neurologists. They're osteopathic psychiatrists. We don't say that they're osteopathic psychiatrists because they're more aligned with the standard medical model.
Right, they can prescribe.
Yes, they can. Oh, yes.
Right.
They're osteopathic surgeons.
Right.
And some folks prefer osteopathic physicians because they do have more of a holistic bent.
Sure.
Although very few of them manipulate and do the use holistic methods like we use holistic methods every day.
So what can you do as a chiropractic neurologist that a regular chiropractor cannot?
Licensure-wise, nothing more. But the ability to treat concussion and pain that radiates, pain that's more obscure, that medical neurologists often treat. I often treat many of the same conditions that medical neurologists treat, and sometimes in conjunction with them. If people have multiple sclerosis and their own medication, sometimes I can decrease the number of adhesions that are forming in their calves, for example, if they have it affecting their leg, which allows them to walk better, showing them rehabilitative exercises that will allow their lives to be, so they can move more freely through space. That's one example. But the people who have had nerve blocks that don't work over a period of time, and that's often the case, they need relief just to get by. Even people that have cancer that are dying and they know that their days are limited, they want some relief, and it brings pause to their relatives to realize, and they're grateful that this person can exist on a little bit of a higher plane than where they were before. Those are the extreme examples. Concussion, headaches, pain that radiates into the arms and legs. And what I'm going to speak about today are the more obscure things that occur with people that have long-term symptoms of headaches and concussions. That is that one often gets pain and tingly sensation and lack of the ability to hear as much as they once did, or have tinnitus, which is ringing of the ears. There's a tube, and I'll start with the eustachian tube. It's in the back of the mouth. Who knows what that does, other than when we're on a flight and we have to open our mouths to kind of clear that pressure, or chew gum, which is what they often give to people when they fly on international flights. The eustachian tube starts in the inner ear, just inside the eardrum. The eardrum has fluid behind it, and there are 3 bones there that vibrate when air hits the eardrum, the incus, the malleus, and the stapes, and that stimulates the cochlear nerve, which allows us to hear. Those bones live within a fluid medium that's constantly changing. There's new fluid going in, and the old fluid leaves. It leaves through membranes, and it also leaves through the eustachian tube, which is a tube that runs down and forward from, let's say, a point behind the eyes about 4 inches into the back of the mouth. It goes into the top back of the mouth behind the molars. Now, when you open your mouth and look, you'll not see it. It's like a little crack. When fluid runs through it, you can see it. Like when a man urinates, you can see that his urethra is round, not flat when there's no urine going through it. Same thing with a woman, before she's urinating, she only sees a crack there. Then when the urine comes out, she can see that it opens up. If the eustachian tube is infected, or if the fluid there has too high a viscosity, if it's like the milkshake that's so thick that you have to eat it with a spoon, which I happen to like really thick.
Me too. I've only had a couple thousand milkshakes.
So if the fluid the eustachian tube is infected, or it's too thick, or it's not as much as it should be, then it would dry the tube and not allow the pressure to escape the inner ear. You get pressure building up in the head that is similar to and mimics sinusitis. Now with sinusitis, if you bend your head in various directions, it gives you an indication of which sinus is involved. Give you an example about the sinusitis aspect of how that can muddle and cloud our ability to understand what's happening with concussion. But at the same time, sinusitis can be secondary to what a concussion is. The 2 sinuses above the eyes drain downward into the nose. The 2 sinuses beneath the eyes drain toward the nose. So if you lie on your left side, the right sinus beneath the right eye drains. There are sinuses behind the eyes, behind each eye. If you lay your head flat down onto your bed, or just tilt your head forward, and you wait about 5 minutes, and your nose starts to drain, then those sinuses, they're called the ethmoid air cells, behind the eyes are draining. Now, if you have a concussion and you have sinus-like symptomatology, putting your head in those various positions, even when the pain is spiking, that can help to rule out that you don't have sinusitis.
It's interesting when you talk about all those areas, and you're probably, I'm assuming, it's a process of elimination when you're dealing with those. You know how we talk about acute pain and chronic pain? Can a concussion have that same effect, so that you have a chronic injury, and of course, obviously, you can have an acute one. You get a concussion, right? In a football game. But do a lot of those injuries become chronic in some manner?
And Sonny knows this well, and you may, Joe, know this in your life, that we put things off, we procrastinate, we cover up, and the most difficult diseases to treat are the insidious ones, the ones that are slow in developing, that we really don't know are there until something spikes, or we experience something that makes us think that there's something wrong. In particular, the thoracic spine and the pelvis are 2 areas of the body that really don't express themselves with pain, whereby neck and low back pain is often felt. But many times low back pain originates in the middle back from lifting things, and pain in the hips, we don't often feel. We feel low back pain because the nerves that leave the low back go through the hips. But when a rib is out of place or not moving freely, or if there's muscle spasm by maybe doing too much chest work in the gym or lifting something improperly, we don't realize that we're not breathing as well as we once did, but we do realize we're not breathing as well when the rib is manipulated or coaxed or pushed to go back into place and to operate properly. Imagine if one rib is out of place on the left side, with each inhalation, the right rib cage has to expand more to make up for that. You may say, okay, well, that's good. It makes up for it 100%. It doesn't make up for it 100%. Imagine with every breath, you inhale 1 cubic inch less of air volume. Maybe twice the amount of the volume of a cap of spring water.
Sure.
Doesn't sound like much, but it is a lot, because it's with every breath.
Sure.
Whether we're walking upstairs and we're breathing heavily, or walking to our car, or breathing at night. And that's also one of the problems with muscle spasm. People think that muscle spasm is, the crampy feeling that they get in their leg. If they're out of shape, or if they're exercising, you play basketball, you're very athletic, I'm sure you've experienced it. Muscle spasm is between 3 and 10% muscle tightness that shouldn't be there. And they say, well, shouldn't I feel that? No, you don't feel it. And once again, that has to do with the insidious nature of diseases that take a long time to develop. And Sonny, you know, probably from your law practice, people have problems. It's like, well, why didn't you seek help earlier?
Right.
Well, somebody mentioned it to me, but it's like, well, it's a year and a half later. So it makes it more difficult to open up the case or to treat the patient when the insidious diseases like mild headache or concussion that occurred many years ago. The reason why, I'm glad you asked that question, Joe, because now that the community has an increased awareness of concussion.
Yeah.
They may not necessarily know what the symptoms are, and the symptoms are kind of fluid because we don't really know. It's not a very finite science how to diagnose concussion. But it's good that more and more people are coming to realize that. Women in their 40s are saying, yeah, I remember when I was a cheerleader, they dropped me once and I hit my head, or I was playing field hockey and somebody elbowed me in the head. Football player might have fallen and had his bell rung, as we know that phrase to be used by coaches, and not necessarily lost consciousness, but had become disoriented and then continued to play.
Well, I gotta. So you're going through a lot of the situations. I'm immediately, a lot of things are coming to mind,
Me too.
especially when go ahead, Sonny. You go
Well,
first.
I usually hear that from my colleagues on the other side. That's the question that they'll ask my doctor. Well, the records indicate that the injured worker didn't lose consciousness. So how could that person suffer a concussion? So my question is, doctor, do you need to lose consciousness in order to suffer a concussion?
Absolutely not. Absolutely not. You can get a concussion from sound, from vibration, from inhalation of toxins over a period of time, and it's called concussion syndrome, but it can also be labeled as concussion. Now, what are the things that define a concussion? There are a lot of things. The inability of the eyes to converge. Our cars, and most of us drive, have headlights that point forward, but they point inward and down. And the driver's side headlight points inward more, so as not to blind the person coming toward you. Mm-hmm. That's why it's good to turn the high beams on.
Sure.
Now, if you ever see one of those diagrams, it's not like this heart of love that's pulled along, and that's the field where the light from the headlights of the car goes. It's more like a heart, but like the one arc is shorter, and that's the one that's on the driver's side, so as to make it more comfortable for the car coming to you. Well, the ability to converge our eyes is very important. Sharks have their eyes on the opposite side of their head. Horses' eyes are kind of like that. They can turn off their vision to that field of vision that's most important to them. That's why when you approach a horse, it should always be slow, because they turn their head a little bit, and they smell your hand, and then you can pet them.
Right.
You just don't grab them like that, because they can whinny back. And it's kind of like the same thing with dogs, because some of them are failures. So convergence, the inability to converge properly, is just one of the many things that can demonstrate that you have a concussion.
I'll tell you. So I played football growing up, and I was a running back, and I was a head first guy. I weighed about 180 pounds. And I'm low. My dad always used, the best way to when you're a running back, and I wasn't a fast one, but it was always like, well, you can either take the blow or you can give it, right? And it's funny because I remember a couple hits, and I remember where we were playing a team called Harry Truman High School, and the quarterback threw 2 interceptions on the same play to the same guy. And I was taking a fake out of the backfield, and this kid was strong, and I lowered the boom and hit him, and it was jarring, but I didn't black out, but it was and I had a lot of hits like that head on, even in practice. But I can tell you that the times where I definitely had a concussion, and obviously I'll never forget it. Monsignor Bonner kid hits me on the side of the helmet. Wasn't even a hard hit. I remember getting up. It was the end of the game, and I went back to the quarterback in the huddle, and I said, "Do not give me the ball. I don't know where I'm at." Now that was a fact. Now after, by the way, I never left the game. I was, I came to my senses, I guess, a couple minutes later. But interesting point. I was playing flag ball. Mm-hmm. Okay, I'm playing defensive back. Never forget it. And this team I didn't even want to be there, to be honest with you. I got suckered into this game. Next thing you know, so I'm covering this wide receiver on a corner, right? Flag balls, the kid takes a step towards me, backs up. Throw him the ball on a screen. He catches the ball. The whole offensive line, and it's flag ball. They had a design play. Ran me over. I remember hitting over, and I remember blacking out. And I remember having a concussion. I remember I was sitting, I had my hand down. It felt exactly like that. And I thought, now, that they didn't hit me on the head there. My head hit the ground. But the one concussion that I was 100, it wasn't even one of those hard hits. It was like on the side. A lot of these concussions. So it's so, and I wonder sometimes today, if I have short-term memory loss because of those things, what are the long-term effects? And by the way, I never got treated for any of them.
If you have muscle spasm in your neck, which results from a concussion or any other type of whiplash,
Which I get a lot.
the blood flow to the back of the head is limited. The carotid artery supplies blood flow to the front two-thirds of the skull. The vertebral artery, the one that goes up through the spinal column and then makes an S-turn and goes into the back of your head, innervates the back third of the brain. The back third of the brain is where your visual center is. The front third is, behavior and intellect and the ability to differentiate sound versus language, and languages that you know and language that you don't know, and the generation of movement. But back here is where it's regulated. And the cerebellum, which is a little bit below the back of the skull, is responsible for limiting your motion. So if you have muscle spasm in your neck, it cuts off the blood supply to the back third of your brain. More specifically, and I'll get away from the blood supply aspect that is diminished from muscle tightness, and it occurs while you're sleeping. You could be in the shower, taking a nice warm shower, feeling loose as a goose.
Like I always have muscle tightness when I'm sleeping. It's one of the main reasons. You see the bags under my eyes? It's because I don't sleep well. My neck, when I get tension or whatever, I have a hard time connecting with my pillow. If I don't sleep well, it's because my neck is uncomfortable.
Cervical pillows are very important. I sell one in the office. They're made in Canada. They're warranted for 5 years. For a few years, I resisted selling them because they are more expensive than others. Although now, because more people are aware of the proper positioning of the neck while sleeping, some cervical pillows sell for $150, $200. Mine are like $100. And sometimes patients can get them at a better price online, so I invite them to do that. What it does is, it's basically a pillow with a hole in the middle. You lay on your back. It's the best position to sleep in, on your back, with your head resting atop a cervical pillow and your legs elevated 9 inches, which will decrease the curve in the low back and allow the blood to flow in the disc easier. The heart doesn't have to pump as hard when your body is supine. And when your neck is in a more advantageous posture, which is where the 7 bones in your neck that arc forward are maintained. Like we're sitting, basically looking straight ahead. Each of us have 7 bones in our neck. If you look down a little bit, the top 3 bones are flat. If you look down like this, and I know you're doing this all day, Sonny, and Joe, you
on the computer, right?
Eating, reading, 5 of the 7 bones are flat. If you flex your neck all the way forward, all 7 are flat, and that's bad. Because the muscles in the back of the neck are working overtime all the time because they have to hold your head up.
Well, my chiropractor actually told me, and he happens to be Lenny Roberts.
Sure.
So I had I always used to do exactly what you said. Now I have my computer on several books, okay, and I'm looking straight at it, if not just a little bit up. Good. When I sleep, and I cannot. What is from having arthritis in my neck from, I guess, playing a lot of sports and using that the old method of lowering the boom head first. I sleep on my side, and I can't sleep like this. I have to have my head supported and even so that it's not pushed up or It's not pushed down. It's
very important. The best position to sleep in is on your back with your head resting atop a cervical pillow, which supports the neck. A pillow with a hole in the middle basically what it is. The head arcs back, and the neck has support. A regular pillow jacks the head up, and 3 of those 5 bones are flexed. You don't want that all night, and there's no support on the neck. You want the neck. When you lay on top of a cervical pillow, it should feel like the weight of the neck is on the pillow, and the weight of the head is on the pillow. Not with a regular pillow, all the weight of the neck and the head is on the pillow, and your head is up like that. Having your legs elevated slightly decreases the curve in your low back. The less pressure, the less work your heart has to exert while sleeping at night, the deeper sleep you'll get.
Well, and there's no doubt. I mean, I gained a lot of weight, so and I'm working. I'm now, making that change. and that's been a problem. But one of the things I'd love to ask you right now, because we're in a really interesting area, and these may be self-serving, issues, but my God, the things you're talking about, in other words, that benefit everybody. Migraines, okay. Do you treat them?
Absolutely.
Okay,
Yes.
ready for this one? Did you see Michael Jordan, the documentary? What's it called?
Oh yeah, I did see it, Joe.
The Last Dance.
The Last Dance.
Yeah,
Right?
Last Dance.
In that documentary, Scottie Pippen talked about one of the NBA championship games where he had to come out because he couldn't see because he had a migraine. Well, nobody, I'm sure you knew exactly what he was talking about, but the minority of people, including me, that had no idea what he was talking about until 2 years ago when I was, for all intents and purposes, I had the wrong glasses. I was working over the Christmas holidays hard on a computer, and I didn't have the Blu-ray glasses and the prescription, and I was focusing real heavy on it. I started to get this kind of like tunnel vision look where it looked like I had water like sort of like a little blurry right here. I was on a radio broadcast with somebody, and in the middle of that, at the end, saying bye, I started to lose my train of thought. And when I was driving, aside from my glasses right here, on the sides of my eyes, I started this, and this happened for a couple of days, I started to see like I was underwater a little bit. I'm driving up to Abington. I was on a long, road, and I feel it going again. Right, all of a sudden I pull up to the light, and it totally shuts. Now I can't see anything. It's not dark. It's not a black light. It's like I'm completely underwater. Now I think I'm having a stroke in the car. Right. I got lucky because I pulled over as it was happening. There wasn't the side of the road for 3 miles until I got to the light. Right, one thing leads to another. I walk around the car. I cannot see. I sit down. Some guy asks me if I'm okay. I'm like, I don't know. It starts to come back. They take me by ambulance to Abington Hospital. Everybody said you had a mini stroke, couple mini strokes, except the neurologist. He came in and he said, and he was the last one. He said, you had an ocular migraine. And he said, and I explained, and it started with a pain in my neck, okay, where I got a migraine and a pain. I had no idea about it. Well, I wondered if there was anything I could do. I never had anything like it again. I never strained that hard with my eyes.
Right.
But is that Doc, what is that?
Yes.
The International Classification of Diseases was upgraded about 3 years ago, ICD-10. It was ICD-9, now it's ICD-10. And we in the neurology world rejoiced because instead of it just being concussion with loss of consciousness or concussion without loss of consciousness, I believe the third concussion heading was concussion, loss of consciousness, less than 30 minutes. Now there are 20 of them. And they divert into, and they merge with, and because they're substantially connected, ocular migraines, visceral migraines, stomach migraines, auditory migraines. Getting back to what I said earlier about how sound and the inhalation of toxins over a period of time can cause similar maladies. We're going to talk about how the ocular migraine could have occurred from the outside of your scalp. But first, let's go back, Joe, and you brought up a good point about sleeping on your side. A lot of folks do. The second best position to sleep in. It's not as good as sleeping on your back with a cervical pillow and your legs elevated 9 inches. I said that 3 times, I know, but that's the emphasis.
Right.
And in my office, like I drive it home. If you sleep on your side, you want to make sure that you have 2 pillows under your head, which is probably what you already do.
Right.
Because you want your head and neck to be parallel to one another and your neck to be perpendicular to your shoulders. So you don't want to be with your head tilted slightly to one side or the other, or your neck bent one side to the other, or your chin down. Remember we talked about how the architecture of the bones in the neck arcs forward. A lot of folks sleep on their side kind of like in that fetal position with their head down. You should never sleep on your side with your arm over your head. Why? Because the nerves that come out of the middle and low neck area, they go to the heart, the upper chest, the shoulders, and arm come out and go underneath this bony prominence here. And at 80 degrees, that nerve, you can start to feel it. If you just put as you're sitting there listening to this broadcast, if you put your one arm to the side, at about 80 degrees, you'll just feel something in there. It's not a big pull, but it's just something strange. If you lower your arm to 60 degrees and pull it back a little bit, you'll feel the same thing. So arm over your head isn't good while sleeping on your side. Sleep with two pillows under your head while sleeping on your side.
Which is what I do.
And lift your chin. How do you get ocular migraines? From the outside of your head, different than the explanation for how you get ocular migraines from the inside of your head. But if you have muscle spasm in the back of your neck, it tightens the blood supply. It limits the blood supply to the back third of the brain. There are 6 nerves that come out of the upper neck that move backward and then go up over atop the skull. 2 of them go over and around the ear. 2 of them, one on each side, go to the very top of your head, and then there's 2 in between those 2 that go up about 4 inches. So if you were to touch your earlobe and then push into your skull, you'll feel this big stalactite, like bony prominence pushing down. Stalactites are big things that hang from caves.
Yep.
The water's dripping for millions of years, and every time it drips, one molecule of whatever stays, and then it takes all those years for the thing to get 10 inches long. That's because one of the biggest muscles of the neck that turns the neck originates there, and it's a worker. Right behind that stalactite, if you push up a little bit, there's a little bit of a nook, a little bit of an indentation. That's where the nerve that goes around the ear is. If you have muscle spasm there, that irritates that nerve. You may say, okay, well, how does that affect eye pain? There's a muscle behind your head called the occipitalis. The occipital bone is the bone between the ears and the back of the head. There was a famous Broadway singing coach named Belt. His last name was Belt. I don't really know the whole story, but he taught that it's easier to sing a high note, which is more difficult than singing a low note, by pulling your ears back. Like a kid would pull their ears back in grade school to kind of. Some folks can't do it because they don't either have the muscle or their muscle isn't big enough. The muscle starts in the midline. There are 2 of them, and it radiates out in each direction. It's about the size of a Post-it pad. So if you pull your ears back, you can speak higher and you can hit a higher note if you're singing. If the nerve that goes around the eye that I described, the one that comes out of the nook behind the stalagmite or stalactite behind the ear, is irritated, it affects that occipitalis muscle. Occipitalis muscle runs over the occipital bone, which runs over the occipital lobe of the brain. That can irritate the nerve that's in the midline of your head. Now, this is something that it's pretty simple, but most people don't know. I asked them to feel the back of their skulls, and it's like they feel like a little golf ball sticking out, like 1/3 of a golf ball. It's at the very back of your skull where your neck meets your skull. If you feel 1 inch below that, there's like a hole, and the hole has 2 sides to it. Those are the paraspinal muscles that hold your neck up. On the 45-degree angle out of that hole are these big nerves that come out and go up to the top of your head. Now, if you feel underneath the eye socket, you'll feel a little indentation on each side. Everybody has that. There's a little hole above that, and there's a nerve there that goes to the top of the head. So if you have muscle spasm in the side of your neck, it can irritate the greater auricular nerve, the one that goes around your ear. That irritates the occipitalis muscle. That irritates the greater occipital nerve. It's a big nerve that goes around the top of the head, which irritates the frontal nerve, which comes out of the top of your eye, which can cause divergency or convergency problems, anhidrosis, lack of moisture to the eye, and other visual dysfunction. That's from the outside. I don't think you want to hear my description of how it affects you from the inside. But tears are very important for the eye because it's not just moisture. The only way the cornea, which is the clear covering of the eye that you really can't see, gets its nutrients is through tears. And proteins are transferred that way. So tears are not just, so if you sleep on your side, Joe, it's not good to sleep, for example, on your left side because the tear ducts are in the upper outer part of the eye. They don't get to wash across the eye like they normally do. So the inside of the bottom eye doesn't get the tears, doesn't get the protein to the cornea as much as it should be. Let's get back to the eustachian tube. The flora in your mouth, the flora is normal environment. Most of us have oilier foreheads than we do cheeks. Of course, our armpits and our genitalia have a flora too. We all know about that. So we all smell and we're sticky at different parts of the body. If the flora in the back of the mouth where the eustachian tube ends is more acidic and out of balance more than what it should be, that affects the eustachian tube and its ability to drain into the pharynx, which is the back part of the mouth, which could cause backup, which could cause pressure in the inner ear. So all these things are related to concussion syndrome. And here I am. I'm not a endodontist. I'm not a periodontist. I'm not an oral surgeon. I'm not a dentist, although I do work with dentists for TMJ, which I treat a lot. Sometimes it's secondary to concussion. I tell them about the flora in the back of the mouth and how it should never really get to be too acidic. It becomes too acidic, too sour after about 4 hours. Eat breakfast at 8 o'clock, breath gets a little sour before lunch. Eat lunch at 12, let's say, breath gets a little sour, you feel kind of rancid at 4 o'clock or so. People drink tea then, they drink water, and then that's good. At night, we should brush our teeth and floss and put a solution in our mouth for 30 seconds to help kill the colonization, the growth of foci, little organisms that are around. If you don't do that for 1 day, and sometimes I admit I don't brush my teeth every single day of the week, like once a month I skip, like on the weekend. Of course, my wife tells me about it the next day. Right?
My wife tells me about everything.
The foci, little round organisms, which aren't too harmful but make your breath smell bad, develop into flagelli, which are long, narrow, squid-looking like microorganisms that have little tentacles in the end that can eat through your dentin, right? And that weakens the tooth. And that has to do with enamel and all those dental things. But it's good to make sure, and I ask patients who have eustachian tube problems, and I treat the eustachian tube, to make sure that the flora in their mouth is as neutral as possible.
Now, and so you see a lot of these issues. One of the things I wanted to ask you, I remember when what you're saying, talk about sleeping and comfort, and a lot of, I'm definitely, working on a lot of that stuff, but I remember when I had the ocular migraine on the weekend before it started to kind of cloud up on the sides of my face, I had a real migraine. And I remember, and this has never happened to me before or since, I went and took a hot shower, put the water on my neck, told my wife, listen, the computer's on, everything's down the basement, I gotta go. I passed out and all that. Then a day or two later, I started to get impacted. After the ocular migraine took effect, after it actually, everything caved in, it all went away. And of course, I fixed the glasses, but it's one of the scariest things you could ever imagine. You go blind,
right.
And is there after effects of that, or is it? Heard Scottie Pippen talk about it like it was normal.
Listen, you were driving. Thank God you were stopped at the time.
Oh my God! I was coming up to the light, and as I did, I started to see this thing coming, like complete tunnel vision. I pulled over. Thank God there was a side of the road there, and so, is there any after effects of that, or is it,
I'll address your question in a moment, but there was a woman who was working for the federal government who was hit in the head by one of the customers there, and she was delirious. They said, no, we want to take you to the hospital. No, thank you. I'll drive myself home. And she passed out. She felt faint and pulled over to the side of the road and passed out for 20 minutes. Awakened, called her daughter. Her daughter got her and took her to the hospital. She lost her consciousness. But and Sonny's an attorney, and you deal with things like this all the time. Had she gone to the hospital from the facility, it would have been much easier for her to get that legitimization to her injury. Mm-hmm. They didn't see her lose consciousness.
Right.
Her daughter, got her and rescued her, and she lost consciousness.
I never lost consciousness. I just went blind. Like, in other words, I even had the guy's phone number who pulled over on the road and helped me. I don't want, I want to talk to you once when we're off air, because we can go on forever about this. I want to, because I really appreciate the information. There's so much things that you as a regular person, you're like, I guess I'm just deteriorating or something. I don't know, but sleeping and doing those things. Let me ask you. Let's segue, even though it's a hard segue. Into what you do. In other words, your practice. Do you do regular chiropractic and
Yes.
neurological?
Yes.
Okay.
Some patients still see me as a regular doctor of chiropractic who treats neck and low back pain.
And Sonny, and you treat injured workers and
Yes.
people that are injured in accidents and stuff like that.
Yes, and it's challenging, and those folks, there are a lot of doctors who don't like to treat patients who are involved in work injuries because they don't like to produce the documentation. They don't want to deal with attorneys. They don't want to have to be,
Especially attorneys like Sonny. He's a problem.
deposed. They don't want to testify in court. Their documentation has to be good. The insurance company won't pay if their bill if the documentation isn't appropriate. They can be challenged by utilization review, by a fee review through the state of Pennsylvania. You don't get paid for 30 or 60 days. And this is why it's very important that, we talk about civil rights. The fight for civil liberty is never won, but we think of civil rights and the 60s and the civil rights movement in America, but there's a civil right of the ability to get treated if you're injured on the job, or the right to get the right therapy if you're involved in a motor vehicle accident, and not be intimidated by people who want to ignore you or who don't take your injuries seriously. But getting back to your question about the ophthalmic migraines and if it has a long-lasting effect, the eyes are very vascular. They have a lot of blood supply, which is good. It's more deleterious for the tears to not wash through your eye at night and all those proteins to go to the inside of the eye, on the down eye, if you're lying on one side, for many, many years, even if you didn't get struck in the head, as you did a few times playing football, compared to the short-term intermediary effect of what you asked about. Unless you have a partially detached retina, which sometimes occurs, and sometimes you don't know you have a partially detached retina, you have to go to a good eye facility for that. Then, for the most part, no, visual dysfunction is often transient.
And when you and I'll ask you, when you're talking about these issues, okay, Sonny, how and obvious. When somebody has a head injury, or issues like this at work that might cause a head injury, somebody gets. How difficult is that in regards to when you're representing somebody? Is the insurance company or the court sensitive? Is it harder to prove concussions rather than somebody who walks in a cast who clearly just had a broken leg?
Yeah, and I think that the doctor would support me on this. Symptoms associated with a concussion are oftentimes hard to identify, and when they are present, I think folks seem to think that you're magnifying your symptoms for secondary gain, as opposed to understanding that this is a real injury. And I've got clients who suffer a concussion and suffer work-related migraines who really don't want to take medication. They want a different approach, and that's what Dr. Saraceno gives them.
Doctor, is the majority of your patients? Well, first of all, how does it break down? Normal, regular patients that are coming in for injuries, and then obviously regular wellness, and then of course I guess neurologic issues.
All patients with concussions have neck problems, all of them. And half of those folks have abdominal disorders, which I haven't touched upon through the vagus nerve, which is the biggest cranial nerve that goes into the abdomen way down. Likewise, when I gain a patient's trust, if they have chronic low back pain, we start to talk about digestive issues because the nerves that come out of the low back go through the abdomen. And we talk about gait and things like that. But neck pain irritates the nerves that go to the heart and go to the upper chest, shoulders, and arms, and of course the blood supply to the back of the head. Only when I gain their trust and they see that the results are good and hopefully profound and beneficial, are they more receptive to me asking questions about pressure in their head and sinusitis. A lot of men don't like to admit that they have sinusitis, and many men don't have sinusitis as often and as frequently as women. But and that's another thing. Women use a lot of perfumes and lotions, and these things, get into the pores. You shave your armpits, and it gets in there, and these are other questions.
So as a chiropractor treating a head injury, do you focus more on the neck than the head itself?
First neck, then skull, then brain. Always have to clear out the neck. From small muscles on the front of the neck that have a lot to do with swallowing and breathing and talking and allowing your head to rotate, to the big, strong cables that hold your neck up in the back. Once I feel that the neck is satisfactory That's 10 to 15 treatments sometimes. Then I get into the skull. Now, we haven't even talked about the skull, and it's a long and elaborate thing, but we talked a little bit about what happens in the skull with the eustachian tube and the nerves that run up the back of the skull. But the scalp is critically important. You know, women who have long hair, and even men might have said, if they have a headache, "Oh, I wish someone could just pull my hair," but gently and therapeutically. And some women, they do this on their own. If they have long hair, they would get a barrette or a pin. Let's say they have pain right above their right ear, 2 inches. They would get a barrette, and it would kind of make it fashionable so that their hair kind of goes over their head starting there, and it pulls a little bit more there than elsewhere. And they keep it there, and it's almost like a self-imposed therapy, and that's wise. Then maybe an hour later it feels good, and they kind of take it down and they kind of shake their head. Oh, the tension in my scalp is diminished. So treating the scalp is very important. There's a compartment between the inside of the scalp and the outside of the skull, and there's turnover there, right? Fluid goes in, it gets beat up, it leaves, it has to drain, and that ratio, just like the ratio of the fluid inside the inner ear, needs to drain through that pressure relief valve, we'll call it, of the eustachian tube, and how if the tube is blocked at one end, it's going to irritate that, or if the production of that fluid in the inner ear is excessive, the eustachian tube may not be able to handle it. So we hold our nose when we blow out, we feel pressure going into the inner ear, and that's through the eustachian tube. And so manipulating the eustachian tube is not easy either. You have to first work on the jaw. And the jaw muscles start on the side of the head, way above the ear. And they go into the jaw, and I work on the jaw tissue as well.
Are the majority of the what a big portion are headaches in regards to the neurologist part of your practice? How big is that, and migraines, how big a part of the neurology part are they?
At least 60 to 80%.
Okay.
Every patient that has a concussion has headaches. Every patient. Every patient that's had headaches since they were teens, there's some people that have headaches starting in their 30s, sometimes in college. The longer term and the more insidious, and here we go with the word insidious, the more subtle it is for a long period of time, the more it creates long-lasting effects elsewhere.
You would think, I'm going to take a shot at this one, but a lot of athletes, you probably treat a decent amount of athletes, people who, soccer players. How big a part of your practice is that? Because I think about it, people don't even. Well, let me ask you a question. What are they? What's that? With the NFL players that are committing suicide? They have that. They had concussions and all that, and then when they can't tell.
Post-traumatic stress syndrome?
No,
more of a
no. What's it? It's
encephaly.
Whatever it is. They have to just dissect your brain and
to
find out if you have. They can't tell unless they do a cross section of your brain. Junior Seau had it, where he had. They have long-term, issues from concussions, but they can't tell unless they actually do a biopsy of the brain, afterwards.
Right. And most of those athletes suffered multiple concussions.
Yeah, you probably, you're probably, but I wonder, you wonder if
the severest concussions come from soccer players.
Yeah.
Can you imagine heading a ball and hitting someone else's skull?
Oh, my God.
When I was in Little League, boys up to a certain age couldn't throw curveballs because they knew that would avulse or pull the tendons off.
Yeah, right. When we were kids, you weren't allowed to throw a curveball until you were in high school.
Although they did.
Yeah.
And I think that soccer players should wear not necessarily helmets, but like padded headbands.
Oh, absolutely.
I think that heading a ball should be outruled or should not be allowed in high school. Boys that wrestle, and this gets into another aspect. I mean, the neck bridges that they do are necessary because that's what wrestling is all about, or part of what wrestling is all about. But
these are the initials you were giving us, Joe. CTE, degenerative brain disease called CTE, is what Junior Seau had.
Yeah, that's exactly right. So they don't find out until somebody when he committed suicide, he shot himself through the heart and donated his brain. Mm-hmm. And they're finding out, especially all these pro football players. But Doc, you're right. A lot of soccer players.
The high school wrestlers lose a lot of weight, and they dehydrate, and they become bulimic, and it's not a good thing. Some of the ladies that are in ballet do that.
CTE stands for chronic traumatic encephalopathy. ENCEPHALOPATHY.
Yeah, the doctor. When you talk about treating people, is wellness a part of what you do?
Yes, and the more long lasting, the more faith the patient has in the process. Then we start talking about breathing. And once again, the thoracic spine, the middle rib cage area, you don't necessarily know it's restricted until it's unrestricted. Just like stress in our lives. We don't realize that there's stress if it's low-grade stress that's been affecting us a while until it's improved, until it goes away. It could be a vent over your desk. It could be the resolution of the screen on your computer. It could be an employee or employer or coworker that's there that kind of says something, and their tone of voice affects you. And these are things that affect us in the physical world as well.
When somebody comes in and they're having symptoms, what's step one? In other words, obviously to diagnose them, the exam, and then the treatment. There's so many things that you're thinking about.
Well, let's talk about the exam. I mean, so many times I examine a patient who has neck pain and headaches, and they've never had the exam that I perform. First, you do a very thorough case history, and they have to be relaxed. They have to feel like they're with someone that's competent. You have to listen to them and hear the words they say. Then you have to do a regional neurologic and a regional orthopedic examination. Many times, if a patient comes in and they've been to more than 3 or 4 other doctors, I ask them, I said, has anybody ever done these exams on you? And they often say, no. No one's ever touched me. And I'm checking the skin sensitivity and muscle reflexology, strength and coordination, and how their eyes are moving and the like. So,
Generally, how long is your initial exam?
My initial visit is about 40 minutes. Every visit thereafter is between 10 and 20 minutes long.
Right.
I'm very explanatory with what I do. I like to explain everything to my patients, answer their questions before they even ask them. And some patients are mute to it. They just, doc, just take care of me and get me out the door. Others are like, wow, I appreciate that.
Well, so as far as the practice goes, is it you and you have a team, or there are other doctors?
No, I'm a solo
I
practitioner.
was just thinking I was going to bet my house on that one.
Well,
I
excuse me, Joe. I have a number of concussion medical reports that I've generated for patients who were involved in work injuries and motor vehicle accidents, and I draw from them. So if there are 10 different types of concussions that I've treated, and you come in, for example, and you said you had concussion, several concussions you believe in your past.
Definitely.
I could take various sentences from one and another, copy, paste, and highlight, and make it customized so it fits your person and your needs, exactly. And I'm not rewriting the same words all the time.
Sure.
So that's the type of inventory that we should all have if we have a passion for what we do, because that's a word processing. You got to sit there and struggle and make sure that the title, the name of the file is something that will evoke a memory when this person comes in. Oh yeah, Joe's concussions has to do with, or similar to this woman that came in 5 years ago.
I'm curious, what is the treatment or the typical treatment plan in terms of length of treatment when you're treating a concussion as a result of a work injury?
It takes about 5 to 10 visits just to treat the neck. Then another 5 to 7 visits to treat the scalp and the head and the jaw. Remember, I'll also treat the front of the neck, and these muscles are very delicate. The first visit, for example, Sonny, I work on the muscles that originate on the back of the skull. The back of the skull has, the occipital bone that we talked about before, the occipitalis muscle, the occipital lobe, nerves that run through there and go to the top of the head, which can cause ophthalmic migraines and eye tension headaches. Those muscles originate on the back of the occiput, which is has a chamfered 45-degree angle to it. And the most superficial, longest muscles of the neck originate along the very corner of that superficial area. Then the intermediate length muscles are about 1/8 of an inch deep to that. And on the inside of the skull, at this nuchal ridge, which is at the base of the occipital bone, which is the back of the head, are the smaller, more intrinsic muscles of the head, of the upper neck. So that's where I start, and then I work my way down the neck. The small muscles that attach, and you put your hand behind your head and you feel the bones that stick out. There are muscles on either side of those bones that stick out. They're really small. They're called multifidi, and it's a Latin word that means multitude or many, and there are many of them. And they allow for the very subtle movements of the head. I could ask anyone, please turn your head, even though you may not know too much about geometry, try to turn your head like 5 degrees. Most people can do that. not even really knowing what 5 degrees is, as long as I say something else. Like, well, just turn it a little bit. Whereby you can't do that with any other muscle in your body, because those multifidi, the ratio of nerves to muscle fiber is very high. Power to weight ratio in a car, right? 1,000 horsepower, 1,000 pound car, it's going to be real fast.
Right.
500 horsepower car, 1,000 pound car, it's not going to be half as fast. If, let's say, for example, 500 nerves go to a muscle that have 500 muscle fibers, that's a good ratio. If 500 nerves that emanate from your head go to your hamstring, there could be 3 million muscle fibers there. Hamstrings are strong, but you couldn't draw, if a pencil was tied to the back of your knee, you couldn't draw your name on a piece of paper because your hamstrings don't have that coordination.
So at the end of the treatment program that you just described, do you expect a complete resolution of symptoms, or
No. Often it doesn't happen. Maximum medical improvement. And that's just as important as anything else. Talking about the long-term deleterious effect. Talking about the fact that in 3 to 5 years they should have another PET scan performed or another MRI. They should be reevaluated.
Two things. I'm going to ask you: do you ever do, for a medical legal situation? Do you do depositions?
Oh yes.
I was going to say, you don't typically see chiropractors do, but a chiropractic neurologist with that type of knowledge,
expertise and skill.
Exactly. And how to, I mean, there's not many neurologists out there, in general.
No, and we said before we went on air, I mean, the doctor was gracious enough to speak at our fall section meeting a couple of years ago in front of 700 attorneys across the state, who were all intrigued by what he had to say.
Yeah, I mean, and are you, I mean, it sounds like obviously with your education and your knowledge in those areas, it would be very hard to dispute, Doc, in regards to,
Joe, that's a good point, and Sonny can chuckle at this because I'm sure he's chuckling inside. The judges could be the type of people that coached you when you had your bell rung several times when you were playing football.
Right.
So to them, a concussion is, well, okay, we all had our bell rung. Even if I was a girl in junior high school and maybe we cheered and maybe somebody accidentally hit me in the head with their knee or their elbow. So they only believe it until it happened. They only believe it.
Yeah, because
as
back to
much as
what
it
I said
happened to them.
earlier. I mean, a lot of people don't really believe symptoms associated with a concussion because they're hard to identify, and people think that you're magnifying those symptoms for secondary gain.
and you're breaking it down. How much of, and believe it or not, we only have about 2.5 minutes left, but how much of when your treatment is also educating your patient so they understand
Every visit.
why they're doing it?
Every visit. I mean, there's a tremendous amount of fear going to a new doctor, going to a doctor for something that not is well understood by the community and or by themselves, and maybe they've been shunned by other doctors because they haven't had the expertise or the interest to help them. So, and then the hands-on, a lot of people don't like to be touched, and there's a lot of bad word out there about chiropractic. I don't want to get whacked, right? I think it's dangerous, and we kill people and we paralyze people.
Well, it's interesting,
and it's
though,
very dangerous what we do.
but Doc,
although we're much safer than any other physician.
Absolutely. And the fact of the matter is, today's day and age, we say it all the time, your chiropractor, you probably see your chiropractor way more than you see your general practice, just because of the chiropractic is one of the only places you could walk in, bend over, and walk out standing up. I've walked in scared to death thinking I got to get surgery, and I've walked out thinking I might not even need a second visit.
Right.
But,
Plus, the chiropractor's treatment is actually focused on the injury itself, as opposed to giving you, a pill or an injection that can affect other body parts.
Absolutely. Doc, if you will, contact information at the practice if somebody wants to get in touch.
Yes, I'm in King of Prussia. I've been in practice 40 years. My office is attached to the Valley Forge Casino.
Really?
But between my office and the casino is the Stardust Hotel. It was recently purchased by Stardust. Prior to that, it was the Valley Forge Radisson. Prior to that, back in the Leon Altimos days, many years ago, it was the Valley Forge Sheraton. You may, some of your listeners may know of or may remember the Lily Langtree Dinner Theater, which was in the hotel next to my office. So I'm in the semicircular shape, 10-story high-rise that everybody sees if you travel west on 422 from 202. So it's at the junction of the Pennsylvania Turnpike, 422, 202, and my office is right next to that Stardust Hotel. And the high-rise is called the Parkview Tower.
And your hours of operation?
6 days a week, 8:30 to 6:30.
Wow.
Sometimes on Saturday.
Wow.
Very interesting stuff.
Dr. Mark Saraceno, I mean, we didn't take a break on this one, Sonny.
Thank
By the
you.
way, if we got into all my ailments, it'd be like a triple
We
special.
got into
here.
them last time.
It's incredible. Sonny, if you will, contact information.
Sure. Banks Law 215-561-1000, and our web address is www.bankslaw.com.
All right, I want to thank everybody for tuning into the Pain and Wellness Hour with Sonny Banks here on WWDB Talk 860. We want to thank Dr. Mark Saraceno, chiropractic neurologist, and the website is www.drsaraceno.com. Doc, we really appreciate your time.
Absolutely.
Thank you, sir.
On behalf of everybody on the panel, I'm Joe Doherty. Thanks for listening, everybody.